So we're going to talk about control of blood flow. So this is going to get into extrinsic and intrinsic control like we did with heart rate and stroke volume. So here are the two outcomes for this one. So I want you to look at this figure here. And notice that we've got somebody at rest and then we've got someone playing tennis and really upping their cardiac output. I've never really noticed that they're playing tennis. So going from 5 liters a minute to 25 liters a minute. Okay, so muscle blood flow increases from 3/4 of a liter to 20 liters a minute. So most of the cardiac output, most of the increase in cardiac output is going directly to the muscles. Okay, so notice though that most everywhere else decreases, right? So you look at the relative size of the circles. So to our digestive area decreases, heart increases a little bit, kidneys decreases, bone decreases, brain stays constant, maybe drops a tiny bit, skin increases a little bit. Okay, so why is this all happening? Well, the purpose is when we increase cardiac output, there's got to be a need for it, right? If everything's working like it's supposed to, your cardiac output doesn't just go up for no reason. And so ultimately what's happening is the needs of the tissue determine how much oxygen they need and then therefore how much blood that they need. So during exercise, your muscles are more active, so they're going to need more blood flow. All right. Now, the skin, on the other hand, isn't more active, but we send blood to our skin to lose heat because we're going to heat up when we're doing heavy exercise. And so we redistribute blood flow using vasoconstriction and vasodilation. All right. And so that way, not only are we increasing cardiac output, but we're maximizing this increase. So, intrinsic control of blood flow. So these changes come from within. And so what I mean is the changes in blood flow are occurring to things happening inside the tissue. So if we increase metabolic activity, meaning that these tissues need more oxygen or producing more CO2, that's going to cause vasodilation of the vessels that go to those tissues. Okay, and so this can happen a couple of different ways. We can have metabolic regulation, which is what I just talked about. So if I need more oxygen or I've got a high level of CO2, hydrogen ion, lactate, that causes dilation. There can also be endothelial regulation. All right, and so this occurs due to things that are released in the endothelium. And actually, there's also other things. It doesn't have to be substances released. Or I guess the cause for the substances being released can be the blood cells themselves. Okay, I don't know how you think about blood flow, but it's not nice and smooth. The blood cells are bouncing all over the blood vessels. Okay, and so when they do this, they actually cause the release of nitric oxide, which is laughing gas, and that causes vasodilation to try and minimize or to increase or minimize resistance so flow can occur more easily. Okay, and then there's also that process of myogenic regulation. So blood pressure can be altered due to, let me back up here. So myogenic regulation is due to the stretch or the constriction of a blood vessel. If I have high pressure, that causes increased stretch. And in the kidneys, we don't want more blood flow. We don't want less blood flow. We want normal blood flow. And so what will happen is that will constrict. And the reverse is true if I've got low blood pressure. With extrinsic blood flow, the changes come from somewhere other than the blood vessels or the tissues. And so this is where we get into the neural control. So the sympathetic nervous system causes vasoconstriction through the release of epinephrine. Epinephrine vasoconstricts almost all blood vessels except for the coronary vessels. Coronary vessels actually dilate because we're going to need more blood flow to our heart during this sympathetic response. Okay, so most tissues have a high level of sympathetic tone, which will cause that vasoconstriction. And so if we increase that, it's going to reduce blood flow. And so that allows blood to go somewhere else. Finally, we've got local control of blood flow. And so the muscles contract during exercise, and we need to make sure we get blood to those contracting or working muscles because they have a higher need of oxygen. So exercise causes this sympathetic response, which causes vasoconstriction, but we overcome this vasoconstriction due to local control. Okay, so think about local control will override like global control. So intrinsic can override extrinsic. So can you identify factors that control intrinsic and extrinsic factors that can control blood flow?